Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all over the world. And if you're looking at a way to differentiate yourself from everything else that's going on in dentistry, today is a crazy cool episode. And today we're going to be talking with Dr. Amy Doneen on how you can truly save patients' lives and not just fix or clean their teeth. So do not miss this. Do me a favor, grab a pen and hit the share button. We'll see you in a few seconds.
The Best Practices Show with Kirk Barrett is brought to you exclusively by ACT Dental, the ultimate provider of dental practice management solutions for dentists and their teams. ACT Dental is committed to helping you build a better practice and a better life. If you're looking to grow your production, motivate your team, get back on track, and create the practice you've always dreamed about, look no further. Give us a call at 800-851-8186 or visit us at actdental.com.
Hey guys, welcome back to the Best Practices Show. Thank you so much for tuning in. Today, I've got a crazy cool episode. You're going to love this. And thank you so much for all the comments, the feedback, the shares, all that kind of stuff. We were just having a blast doing this. And we've got some incredible episodes lined up here in the next couple of weeks. So keep tuning in. And again, just thank you for the followers. Right now, there's over 26,000 followers on Facebook, and over 100,000 of you are hitting it on iTunes. And again, I don't even know how that works, but it's so cool. And a couple show notes. Now, we are shooting this live on Facebook. So if you're watching this during the live broadcast, do me a favor. If you have a question, add it to the feed, and I'll ask Dr. Doneen while we're on with her. And then also, if you have questions later on, continue to add them to the feed, and we'll see if we can't get you the answers, because we want you to get the most out of this. Now, my guest today, she's been on before. Had so much fun having you on last time. We were like, we had so much to talk about. We kind of ran out of time, but I'm like, we got to get you back. So Dr. Amy Doneen, and she actually runs the Heart Attack and Stroke Prevention Center in Spokane, Washington. This woman's brilliant. You're going to see here in just a second. She has academic appointments at Washington State University at the School of Medicine, the medical school there, and then also at the University of Kentucky Dental School. So you're going to see how cool this all comes together. And oh, by the way, you wrote a little book that's wildly popular that if you haven't read, you need to read now. And what's the name of the book?
It's called Beat the Heart Attack Gene. So yeah, we want everyone to have access to it. It's written really in a way that is so absorbable to patients as well. So one of our goals is that as your patients read this book, they will be knocking on your door to say, can I come in more often, please, and get a dental evaluation? Because I understand that it's so important as far as my heart health and stroke prevention. So we really wrote that so patients will be absorbing the information and getting into the dental offices more often.
Yeah, absolutely. Absolutely. Now, I always like to talk about why this is so important, because in a world where dentistry is the number one profession in the United States and everyone's excited, but they also think about all the other things that are going on. This is an incredible opportunity to truly stand out and differentiate yourself from other things that are happening in dentistry. And why is this topic so important that you believe so strongly in?
Well, we believe so strongly in this, Kirk, because, heart attacks remain the leading cause of death in this country, and strokes remain the leading cause of disability in this country. They're claiming lives at alarming rates. People are having them every 30 seconds, every 45 seconds. People are dying of a heart attack every minute. People are dying of a stroke every 4 minutes. And so our passion is really to change that. We have a really hard goal, and that is to remove heart attacks off the number one list of death by the year 2020 in the United States. And I'll tell you something, we could not do that without the help of our dental colleagues. It would be impossible. So we really are passionate that we really start talking to one another, and that our medical colleagues and nursing colleagues and people in the medicine arena realize that this is connected to the entire body, and the inflammation that can brew in the mouth, the gum line, and even endodontic lesions is catastrophic when you look at the event rates. So we are really, really passionate. And as we spoke last time, we mentioned the article that we published in Postgraduate Medicine talking about the high risk periodontal pathogens, AAPG, TFTD, and FN, how they affect the atherogenic triad. Finally, once and for all, dismissing the idea of simple association to demonstrating causality. So we publish that in the medical literature so that our medical, nursing, all of the people on the medical side wake up and start knocking on the doors of their dental colleagues and say, we need your help.
Yeah.
Because the reality is, it doesn't matter how pretty the cholesterol is, how beautiful the blood pressure is. That matters. But if you ignore what's going on here, the patients are left vulnerable.
Absolutely. Now, a couple things. We've got a lot of young dental students watching this now and young dentists. So this is a huge opportunity because the conversation in dentistry before was it could be linked. And now we've got proof that it is linked, which is even more cool. The second thing to really consider, too, is you might be watching this as a dentist going, well, how? I don't know. I get it. But no one spends more time with human beings proactively on their health now than dentists do. Like I would argue that's true. Even cardiologists now spend the majority of their time on the reactive side, not so much on the proactive side. And so as a dentist, this is an incredible opportunity. And you know this, if you're a dentist watching this, patient opens up their mouth, you see way more than you want to see. Like you're like, oh, and patients tell you things and they say, I don't grind my teeth, or no, and you're like, oh my goodness. So this is an incredible opportunity where you can truly slow things down and make an incredible impact on the people you serve.
That's correct. And the medical system is in a sense broken, because what happens on our side of things is people are identified of having heart disease after they've had a heart attack, or they're identified of having vascular disease of the brain after they've had a stroke. And so much of the resources, education-wise, technology-wise, are based on picking people up after they've fallen. And so what we've been up to, and when I say we, my colleague Brad Bale and myself, we've been at this for 17 years. And it's really a simple idea on a complex disease state. And I'll summarize it real briefly, because then if I do that, I think our dental colleagues and friends on the air will understand how vital the role is. So really, Kirk, what happens is people develop plaque in the wall of their artery. It happens slowly over time. No one feels it until it misbehaves. When plaque ruptures through the artery wall, the body's natural response to that is to heal it. No different than if you cut your skin and you form a scab. But if that thrombus or scab blocks the flow of blood in the arterial system somewhere, and we have 60,000 miles of vessels in our body. So if the clot lands in the heart, we're going to call it a heart attack. If it lands in the brain, we're going to call it a stroke. So what we need to do is back up the train and say, wow, what are all of the root causes that can cause plaque development and plaque rupture? And so what we've done with our research is really look at the causal effects of vascular disease, one of which is periodontal pathogens, the high-risk pathogens. No longer should people dismiss it as a potential association. We have enough data now, and we've published it in graduate medicine to say these pathogens are dangerous. And when they get into the bloodstream, they affect atherosclerosis in a very, very significant way. So when we look at all the root causes, and Kirk, there are many. There's cholesterol, blood pressure, prediabetes, genetically inherited lipid abnormalities, psychosocial issues, sleep issues. I could go on, but two really strong, valuable root causes are gram-negative periodontal high-risk pathogens and unidentified periapical abscesses. So both from a endodontic side and a periodontic side. And here's the other secret. Those of us in medicine were never trained, right, and we still aren't, on how to assess for periodontal disease, how to treat periodontal disease, how to assess for endodontic disease, and how to treat it. We are not skilled in two very important root causes. So it's really created this, in our opinion, demand that we must start talking to each other. And dentists and hygienists deserve huge praise in the world of cardiovascular disease prevention, and they're not getting it yet. And we are bound and determined to change that.
Yeah, and you're doing such an incredible job with the literature and the teaching. Like, give us, because as a dentist, I might be saying, hey, look, I get this, but Dr. Doneen, where do I start? Like,
Yeah.
I'm busy, we're doing as much as we can. Like, give us some elements of some basic things. And I know you have we're going to talk about your literature here and some of the educational pieces you have. But give us some elements of where to start.
Yeah. So one thing and we spoke about this last time, was one, become your own expert. Read the literature, understand it well enough that you can start talking to your office about it and your colleagues about it and your family about it. So the very first thing is to become educated. And so read our article in Postgraduate Medicine, which you posted last time. And then I would argue, really synthesize that information well enough that it becomes a conversation rather than a challenging topic. Because if we're able to talk to ourselves, our family, our colleagues about it, we can bring it to the patient's, as you would say, chair side, I believe, and start having the discussion that how important it is that the gum line and the roots of the teeth can harbor very dangerous elements that can cause either recidivistic events or initial heart attacks or even plaque development. So it's really important that people start with just becoming educated. And we've worked really hard to create literature so it's easy for people to access it.
Yeah. And so tell us about the literature, because you actually have a system, and can you just show it? Like, it's so cool.
Sure.
Like, you have it in front of you, don't you?
Yeah. So couple things. We have created what's called a dental endorsement package, where for about $100 a month, the dental office can actually use our branding in a sense, so that, because we get calls all day long asking us, is there a dentist in Montana? Is there a dentist in Nashville? Is there a dentist in here that does your method? And we are hard pressed to understand who those people are. So we've created endorsement packages that give dentists the ability to say, yes, we do understand what they're talking about. And yes, we do assess for gram-negative periodontal pathogens in our practice. And we do talk to patients about the importance of dentistry in the relationship of heart disease prevention. And once people become an endorsement of us, we really provide you literature and brochures so your patients come to you asking, well, can I come in every 3 months? I don't think it's right that I come in every 6. I need to see you more often because I've had a heart attack, or I've had a stroke, or it's in my family. And all of a sudden, patients are asking for better care, and you're not trying to convince them. They're asking about it because they become educated. And I would say really one thing that I want to do today, because it's not, I really am passionate that people come to the table and form communities, Kirk. One of the things I want to ask your listeners to do is find a medical provider in their community that is philosophically aligned with this discussion. Find a medical provider, whether they be a nurse practitioner, a physician, a DO, naturopath, anybody that gets it and understands inflammation as it relates to vascular health. And what I really want to do today is welcome your listeners to come to our Las Vegas preceptorship course, which is a 17.5-hour continuing medical education and continuing dental education come together as a team. And we're going to offer your listeners a huge discount on that, because what we want is for a group to come together and start talking about this, so that when you go back in your communities, you have a medical office and a dental office that both get it, and they have the opportunity to bring this to patients as a group. It's a wonderful, wonderful chance.
Yeah, now you're using one of my favorite words that I used to hear a long time ago, but we don't hear it very much. It's called preceptorships. So we just don't hear it like we used to. Tell us what that means and what happens in the program and how people are mentored that way. Can you explain that?
So that's fun that you say that, because I didn't realize it was a unique word. But so twice a year we offer live preceptorship programs. And it's a 17.5-hour course that goes through the whole Doneen method. So from the medical side to the dental side, to really understand what causes vascular disease, what tools are out there to assess for it, to monitor it over time, assessing all the root causes. So when a dental office comes to our preceptorship course, it's not all about dentistry. It's about why blood pressure matters. It's about what lipids mean. What are the indices of the various lipids? What are certain treatments like statins, ACEs? all of these medications that are so familiar to us on the medical side, to really bring everyone up to a new level of understanding on how to identify, treat, stabilize, and regress atherosclerosis. And when I mention the Doneen method, it's a method that's been proven to identify, stabilize, and regress atherosclerosis. We published that with our colleagues at Johns Hopkins, and we published that with our colleagues down at Texas Tech. So we're not talking anecdotal issues here. We are talking a true method that can actually prevent your patients from having a heart attack or stroke. It's critical that we change the whole paradigm from an end-stage disease module to prevention. It's critical. And I've long said that periodontal disease is a medical problem with a dental solution.
That's powerful, very powerful. And it's an incredible conversation that's happening in dentistry right now. I always like to ask you this, and I'm going to continue to ask you, like, what do you see? Because you get exposed to so much good research and so many things that are happening right now. What can we expect to see in the future on the topic of inflammation that's ahead of us?
Well, I think that the biggest buzz right now are genetics. So when we look at precision healthcare, and I mean precision in both dentistry and medicine and every element of healthcare, really embracing the idea of genetics as far as identifying someone's lifetime risk, but also pharmacogenetics, because our host response to even the periodontal pathogens are going to be different on a unique set of patients. So one of the things we talk about in the course are what is available right now in the world of genetically based healthcare delivery to be more precise with our individual patients, even when, and this is not my area of expertise, I just highly respect it, even in the world of periodontal disease, if someone is harboring these high-risk gram-negative pathogens, each of us are going to have an independent response to those pathogens that's very genetic. So there are even genetic tests available to anticipate our response to those pathogens. So it's very complex, but yet it's extremely simple. I think as our knowledge of genetics and our clinical utility of genetics becomes more embraced in both dentistry and medicine, we can offer precise healthcare in patients and really make a true difference with the individual patient. And it's not expensive. That's the other thing. People hear the word genetics, Kirk, and they think, oh, hey, this is like way beyond. No, genetics are one of the cheapest tests we can do because they're one time.
Right.
They're one-time deal. They're not going to change. Really, I mean, there's epigenetics and so forth, but in our individual lifetimes, you get a genetic test once and it's done.
Yeah.
And forever and always we have that information to make, in partnership with our patient, healthcare decisions based on their own unique genetic path.
Yeah. Now, I do get this question because some people watching, like, how do I do that? Are you talking about the 23andMe type thing, or what do you, give us some perspective on what that means?
Yeah, so, there's a lot of direct-to-consumer genetic testing out there to look at Ancestry.com, 23andMe, and all that. I'm not talking about that. I'm talking about genetic tests that actually give plausible information to say, how often should you be screened for, let's say, aneurysm risk? How are you going to respond to a certain therapy based on your genetic presentation, if you will? So the world of pharmacogenetics and how does everything play in the sandbox together? So, if you're taking 4 supplements and 2 drugs that all go through a significant cytochrome P450 isoenzyme pathway, we need to be thoughtful on what we're offering to patients because they might risk side effects even from medication. So I'm not against people accessing direct-to-consumer genetics if they choose to, but the genetic tests that we talk about in our book, I'm going to give you another example to make it more concrete. For example, there's no panacea diet for any of us. I get that question a lot, like, well, Dr. Doneen, should I be vegan? Should I do the paleo? Should I do this? Should I do that? And should I drink alcohol? Should I not? I heard that was good for me. I have to say, I have no idea until I get your genetics. And there's 2 that we've accessed for 20 years, and it's called the ApoE gene. And it helps me understand how your body's individually going to break down fats, carbohydrates, proteins, and alcohol. So it allows me to be very objective in my individual recommendations to you, even from a diet standpoint. And now we use another gene called haptoglobin, which helps me understand, not from an allergy standpoint, but how your body might demonstrate inflammation with gluten intake. So we're getting more and more specific in our recommendations. There is no panacea diet out there. There's not. And so really giving people concrete genetic information so they can use it and really make a difference in their lives is, to me, critically important.
Yeah, well, you've got a big mission in front of you, and we're just excited to be a part of it. And I know we only get you for small snippets of time, but what are some last couple thoughts that you have on this subject, and just other things that are at the top of your mind that you'd want the dental community to know about?
Yeah, a couple things. I really want dentists to understand how important they are. Mm-hmm. And I want hygienists to understand how important they are. We cannot, flat out cannot remove heart attacks off the leading cause of death in this country until we start embracing our dental colleagues. Yeah. Impossible, because we're going to miss major root causes of vascular inflammation unless we start talking to one another. So I'm a huge fan of dentists shamelessly promoting their effect on systemic health. So simple things, dental offices getting educated, coming to our courses, getting on the endorsement package so you can say, hey, I'm a Bail Doneen dentist. I get it. I specialize not only in your mouth and your gum line, but I actually care about you having a heart attack or stroke. And we get questions every day on our website. Who can we go see? Who can we go see? And if we know you're at least educated, and we know you're talking to your patients about the importance of blood pressure and the importance of coming in often and all of that, we can send people to you and start working in collaboration. And all of our medical colleagues around the country will be knocking on your door for help. Little things like, instead of just giving dental floss and toothbrushes in the dental office, give pedometers for those that make all their recall appointments. Just start thinking bigger. And I'm really passionate about that. I think it's so important.
Yeah, not only does it help your patients, but it also keeps you engaged, as a team. Just more new, fun, exciting things to talk about, and when you're on the learning edge. Now, I know you're going to get these questions, and so your literature, the things that you're creating, your learning resources, how can we get a hold of that?
So the best way to access it is go to our website, Kirk, and it's called baledoneen.com. That's BALE Doneen.com. And on that website, you'll see, lots of different areas for resource availability, courses, literature, articles, our Johns Hopkins data, all of that. So you can kind of take a peek at that. Our books on there, of course. My clinical site is linked to that if people have interest personally, but really just getting to that Bail Doneen site is critically important.
Yeah, and if you haven't read the book, read the book. It is fantastic. I highly endorse it. I think it's fantastic. Everybody should read it if you're involved. I don't care if you're involved in dentistry or not. You should read it. It is such a great read. Now, also too.
Can I add that it's just on it? The easiest way to get the book is just go to Amazon.
Yeah.
Just go to Amazon.com and just Google my name, Brad Bail, Beat the Heart Attack Gene. It's available on Kindle. It's available audio. A lot of people just like to listen to it if they're driving a lot or raking the yard or whatever. And obviously in paperback as well.
Yeah. And before you go, just tell us a little bit more about the preceptorship. What are the dates on that?
Oh, thank you. So it's in March, and we only offer it twice a year live. So the next one is coming up in March. It's in Las Vegas. It's March 9th and 10th. It's all day Friday and all day Saturday.
Okay, awesome. Check it out. We will post a link to that. Make sure you check it out and get there if you can. And so thank you so much, Dr. Doneen, for being on. Stay on while we say goodbye to everybody else, because we're going to have you back on a whole bunch of other subjects, because I know we got a lot to cover to make sure we help support your mission here. So
thank you. Thank you so much.
Hey, it is our pleasure. And thank you so much for watching today. I hope you enjoyed today. And if you did, which I hope you did, and I know you did, do us a favor, just hit the share button, share this with your colleagues. We'd love for great information like this to get out there. And until we see you next time, keep watching the Best Practices Show. You guys have a great rest of your day.